Hello, I'm Dr. Russell Jennings, pediatric thoracic surgeon in the Esophageal, Airway, and Thoracic Division, Johns Hopkins All Children's Hospital in St. Petersburg, Florida. I'm here to talk today about a very difficult problem, a life-threatening problem called Asphyxiating Thoracic Dystrophy, or Jeune Syndrome. There's a couple other names, but they're very rare. The problem is the chest is too small in the lateral dimension, in the AP dimension, and in the circumferential dimension. It's really just a really tiny chest, and it's too small to breathe. Some of these are absolutely lethal. Most of them are very compromising from a respiratory perspective, and these children don't tend to live very long. I would like to present today an understanding of the problem and talk about some of the potential solutions. This is a normal chest. A normal chest has the spine, which is right here, with the spinal cord in it, and it has the sternum, or the breastbone, up in the front. And along the sides, obviously, are the ribs, which create the space that allows the chest organs to function and take up that space. In the middle, we have the aorta down here. This aorta is like a little candy cane. It comes out of the top and it goes down along the spine. It sort of hooks around the airway as it goes down. Then we have the pulmonary artery, which is just as big and provides the blood flow to the lungs. We have the trachea, which is right here. It's right in the middle with a little posterior membrane. The trachea is fairly large. And then we have, of course, the esophagus right on top of the spine. We've talked about this before. In the front, we have the thymus gland. The thymus is pretty soft, really is not needed, as far as we know, much after birth. It's really for immunologic development as a fetus, but takes up a little space in the front. What that leaves us is a significant amount of space for the lungs. This is the lungs on the right side, and this is the lungs on the left side. So we have pretty big functional lung capacity on both sides. And so that's a normal chest. Let's talk about what happens in Jeune Syndrome. In Jeune Syndrome, everything is smaller. And that's why it's such a severe problem. Spine, still in the back, spinal cord, here's the sternum up in the front, but everything is smaller in a AP, or front to back dimension, so this is smaller dimension here. The ribs are shorter, so they come around, making the chest circumference or diameter smaller. And then when we go to fit our organs into this child, we have our aorta, descending aorta going down, and our ascending aorta coming up at us. And we have, of course, pulmonary artery, which is diagrammed here, and we have the trachea. The trachea ends up being somewhat squished, discompressed, because there's simply no room in the chest for everything. This is not uncommon. And of course, we have the esophagus. Fortunately, the esophagus can be pushed off to the side, as shown here. And the thymus is now sort of pushed off to both sides. So it doesn't take up some more AP dimension, more it gets pushed off to the sides. What does that leave us for lung capacity? Well, it doesn't leave very much. Basically, the right lung is here, pretty small. The left lung is here, pretty small. You can see the problem. In addition, we have another problem. Normally, the chest is bell-shaped and comes out like this in a normal bell-shaped pattern. The diaphragms are on the bottom, they come up here, and the ribs come around the edges like this. And in the middle, we have the heart. The heart occupies the middle portion, as shown here, and the aorta sort of goes up and over in a candy cane fashion over the trachea, which we demonstrate right here. Here's the trachea right here. And it sort of goes underneath the aorta at one point. In Jeune Syndrome or thoracic dystrophy, everything's much smaller. We have a smaller chest, shown right here, and we have shortened ribs on the sides. In addition, we have the heart, which still occupies the middle of the chest, as we show here, and the aorta, which goes up. And the airway comes underneath here and goes underneath the aorta. You can see there's just not very much space for the lungs, which would be all that excess space. This would be the lung space right here, up in the upper parts of the chest. If we then go look at the chest from the side, we find that almost all of these kids, or a lot of them, have straight spine syndrome. You can refer to my other video about straight spine syndrome. But basically, the problem is that the sternum remains in its normal position, and the normal spine have this curve, which we call a thoracic kyphosis, and it gives room for the heart right here and the aorta, and it gives room for the trachea with its rings right here. In straight spine syndrome, we have a more severe problem because the sternum remains in its normal position. The spine, however, is moved forward, and so it's now straight. And that does not leave a lot of room. The heart really gets kind of squished, but it can't get squished too much or won't beat. And there's the aorta takes up that space, and the trachea itself is compressed. It's compressed by the manubrium and it's compressed by the aorta, and it can be quite severely compressed, leading to more respiratory difficulties. So how would we want to treat this particular problem? We need to make the chest bigger in an AP dimension, or front to back, and we need to make it bigger on a side-to-side dimension or laterally. And we really don't have the capability of making the ribs longer. But what we can do with this small chest, which is basically like that, we can open it up like a book, like this, which will increase the dimension transversely or side to side, and by adding the spacer on the front, we can make it bigger in an AP dimension, or front to back. And you can refer to the expansion thoracoplasty video for further explanation of how that's done. I'm Dr. Russell Jennings, pediatric thoracic surgeon in the esophageal airway and thoracic program at Johns Hopkins All Children's Hospital in St. Petersburg, Florida. I look forward to your comments and questions. Thank you very much.